Guys, let's start with another common important topic of NEET PG in pathology. It's type of classification, and nearly I should start with this types of classification. Calcium deposit appear deeply basophilic. So, and its color is it is on. Okay. In the image A, we can see the purplish color, and which is a color of basophil basically. Okay, so on H and E hematoxylin and eosin stain. Okay, now we should see dystrophic calcification and versus metastatic calcification. D is for basically diseased dead tissue. In abnormal diseased tissue we can see dystrophic calcification, and whereas metastatic it is seen in normal tissue. Okay, dystrophic tends to be localized, like it will be in one structure only. Calcific aortic stenosis widespread in metastatic diffuse, while the name is itself defining itself, no, metastatic is widespread. Okay, now for the conditions which is basically coming in the questions, like we can see dystrophic in the TB, in other granuloma infection also, liquefactive necrosis of the chronic abscesses, fat necrosis, infarct, thrombi, schistosomiasis, congenital cytomegalovirus, toxoplasmosis, rubella, Samoma bodies, CREST syndrome, atherosclerotic plaque can be can become calcified. And etiology, it is to secondary to injury or necrosis. This is all about dystrophic calcification. Now for metastatic calcification, predominantly in interstitial tissue of the kidney, lung, gastric mucosa. These tissues lose acid and quickly and increase the pH, favors calcium deposition. Nephrocalcinosis of the collecting ducts may lead to nephrogenic diabetes insipidus and renal failure. Secondary to hyperphosphatemia, example chronic kidney disease, or hypercalcemia for primary hyperparathyroidism, sarcoidosis, hypervitaminosis, vitamin D. So I will suggest you that you know the definition of it. Okay, and where it occurs, what is the calcium level in the blood. In diseased, it is increased, or it is present in no, I should say in metastatic the tissue is normal but the calcium level in the blood is increased, and uh, the vice versa is present in the dystrophic calcification, where it is calcium is normal in the blood but it is present in the diseased tissue. Okay, this is the difference in between both of them, and also we should know the examples of it, so that in the question basically it will occur, like for example I will say in which of the following condition metastatic calcification is seen, and I will give the option like congenital CMV, schistosomiasis, CREST syndrome, and one other option I will give for metastatic calcification, and I will say interstitial tissue of the kidney, or more importantly I will say hyperparathyroidism or sarcoidosis. These examples are important, keep in mind. Mainly we get confused in it, and it's a simple topic, but remember the examples, I will say. Now we should see some of our bodies we see in the dystrophic calcification. Now we should study about it. These are the first look at the image, where it is the image, concentric ring which is present here also, and these are calcified spherules, and it is a type of dystrophic calcification. Now the examples of it, we know, please, from the mnemonic, please mom don't forget the milk. So from milk we can say about prolactinoma. Please, p simply I will say PSN, the subject is present widespread, so we can learn it from it. Papillary thyroid carcinoma, S for serous ovarian carcinoma, M for meningioma or mesothelioma, and from milk we can learn about prolactinoma. Here we should know the definition of it, and along with that we should know what are the examples which comes into this category. Um, C for amyloidosis. It is an important, extremely important topic, and like questions directly come from this table itself. It can ask like beta 2 microglobulin type of fibril protein is seen in which type of amyloidosis. So we should know that it is associated, beta 2 is associated with dialysis related amyloidosis. To make you easy, beta 2 means two kidney are there. So just for remembering, kidney, dialysis, beta 2, all this come into one category, and it is seen in patient with ESRD, end stage renal disease on long term dialysis. Okay, then we can say what more, beta amyloid protein. This is also asked. Beta amyloid protein is seen in Alzheimer's disease. Then calcitonin also is asked, medullary thyroid cancer. And what more is asked is double A, secondary amyloidosis is seen, and it is also seen in chronic inflammatory conditions, rheumatoid arthritis, inflammatory bowel disease, familiar Mediterranean fever, protected infection. Okay, primary amyloidosis seen in plasma cell dyscrasiasis, multiple myeloma, and AL is a type of light chain primary amyloidosis. Mein. Okay, these were the short, cute thing which is asked from amyloidosis. Also, Congo red stain, apple birefringence. See the image. Uh, amyloidosis, Congo red stain. This is Congo red in color, image A, and apple green birefringence, image 2, and for the definition being about amyloidosis, what is it? It is an extracellular deposition of the protein in abnormal fibrillar form, which is also known as beta pleated sheet configuration, and it is cell injury and apoptosis manifestation vary depending on involved organ and include, like, if it is present in the renal part, then we will say nephrotic syndrome, cardiac restrictive cardiomyopathy, for GI hepatosplenomegaly, neurological peripheral neuropathy, musculoskeletal muscle enlargement, macroglossia, carpal tunnel syndrome, skin waxy thickening, and easy bruising. So these are different names in associated organs, but as soon as the name arises, we can say that okay, maybe there is amyloidosis, there may be protein, abnormal protein presence, and type of the can be present, and the mechanism of action of these diseases. So this is the short summary of it. Hope you got a little bit of crux of it, but yeah, important topic. Next we have in pathology about inflammation. What is inflammation? Injury to the cell, and after that the response to it. Um, then there is cardinal sign, Ruber, Calor, tumor, dollar, and functionalisis. Ruber Calor is the redness and the warmth. It is because of the, you know, increased blood flow, which is provided by histamine, prostaglandin, bradykinin, and nitric oxide. Tumor, it's the basically swelling, and vascular permeability is increased, and that leakage of the protein rich fluid from the post capillary venules into the interstitial space increases the oncotic pressure, and there is fluid flow which causes the swelling. Dollar means pain. So, you have to have money to be out of pain. Sensitize, just mnemonic type of thing, you can go about it. Mediated by bradykinin, PGE2, histamine. Functionalisia, it's the loss of function or inflammation, impaired function. Okay. For acute manifestation, fever, pyrogens, interleukin 1, TNF, COX 1 increasing activity, PGE2 increased temperature set point in the hypothalamus, leukocytosis increased WBC count, and because of the infection, okay, we know about it. Increase in the plasma acute phase reactant, serum concentration significantly, change in response to acute and chronic inflammation produced by liver, notably induced by interleukin 6. Okay, now acute phase reactant. For acute phase reactant, we have positive for upregulation, if it is present, and what is the meaning of it. Okay, so if C reactive protein is high, that means opsonin fix complement and facilitates phagocytosis, measured clinically as a non-specific sign of ongoing inflammation. Okay, ongoing inflammation is a non-specific sign. Ferritin binds and sequestrates iron to inhibit microbial iron scavenging. Fibrinogen coagulation factor promotes endothelial repair, correlates to with ESR. Hepatoglobin binds extracellular hemoglobin, protects against oxidative stress. Hepcidin decrease of iron absorption by degrading ferroptin and decreasing iron release from macrophages. Anemia of the chronic disease. Procalcitonin increase in bacterial infection, normal in viral infection. Okay, serum amyloid A. Prolonged elevation can lead to secondary amyloidosis. Then we have negative down regulated. If albumin reduction conserve amino acids for positive reactants. Transferrin internalized by macrophages to sequester iron. Transthyretin, also called prealbumin reduction, conserves amino acid for positive reactants. So these were some of the acute phase reactants. It's important, memorize it well. Question arises, like in internship, if we see someone C reactive protein is CRP is high, then we can judge the patient is going through ongoing inflammation. If ferritin is high, then we can see like sequestered iron to inhibit microbial iron scavenging. Then fibrinogen, it correlates with the ESR. Clinically, we should, correlate these reactants and solve the MCQs so that we can know the importance, basically what is the crux of it. Okay, so guys, we will see the next thing in the next video. Let's keep it short and sweet. Okay, bye.